my next question. We were both pregnant during the overturn of Roe v. Wade, and we became mothers after it was overturned in a post Roe v. Wade era. So I was going to ask, and you've answered it a little bit in the previous question, how did this event impact your thoughts during pregnancy? And after you shared your thoughts, I'll share mine as well, since we were both in it together.
Yeah. I take care of medically complex babies. I take care of babies with multiple issues, and those issues won't resolve, and they will be lifelong and kind of affect their quality of life. And so I'm very clear in what I would want and what I would want for my future baby. So I've seen all of those things where maybe someone would have had a termination. I've seen them progress and come out, and what that quality of life looks like for all these different reasons. So I know what I want for my own babies, and it's not supported anymore. So it was a very frightening time to be a woman.
I agree.
And work for these women.
Yeah, absolutely. I mean, how can you support them fully when all of the decisions that they could possibly have don't exist anymore, or one of the choices doesn't? I was going to say, for me, the scariest part was about the overturn of Roe v. Wade was knowing it was coming and being pregnant early on and not knowing if I was going to have access or when it would be taken away. It was all very ambiguous for a little while, and the decision was leaked, and we didn't know very much about what was happening. And I did my genetic testing, and I came back as a carrier for cystic fibrosis, which I know is something that children can live with, but I definitely had the thought at 12 weeks, oh my gosh, if Florida, puts through I think it was a 14-week ban at the time, and now we're looking down the throat of a 6-week ban. I just remember thinking, I'm not going to be able to have access if I do need to terminate, or if I make that decision for myself, or if it's something that's going to endanger me, I might not have a choice, just because we didn't know exactly what the stipulations were going to be regarding, what kind of situations would the state or the country allow to us to make. Anyway.
And I should say, it's not just like genetic incompatibilities and things like that. It's women who come in and have an ectopic. Like, I knew I was pregnant at 2 weeks because I was pursuing fertility treatments. But some people come in 20 weeks and that's their first scan, or they don't have access to health care, or they're pregnant as a result of a sexual assault or something like that. And they're just kind of made to stay the course now. Or, if the mom's life is in danger because of a pregnancy complication early on, it's just a real big ethical dilemma that has ensued from all of this.
Right. Obviously, it directly impacts your job in healthcare, and it directly impacts your position as a mother.